Welcome to the Eyecare Experts, Dr. Bell, Dr. Terrezza, and we have with us Dr. Bellard again today. So thank you for joining us. And we've got an interesting topic, I guess, that will cover a lot of medications, a lot of systemic conditions. Today we're talking about eye health and medications, understanding the connection. I think now more than ever, we're hearing about Wegovy, Ozempic. We're hearing about all these, we've heard about Plaquenil, hydroxychloroquine for a while, and there's Topamax. I think there's probably 3 or 4 more we can add into that list. But, even when I graduated school 20-something years ago, we could understand, and we were, doing OCTs, making sure some of these medications don't lead to ocular toxicity or cause problems in the eye. So there's a lot of different conditions we're looking for. There's a lot of things we know. There's some things we don't know. There's studies that are still, looking into how some of these medications may affect the eye, short term and long term. But yeah, anything you want to kind of weigh in as far as how you want to take it, feel free to go. There's a lot of different things we can talk about regarding this.
Well, we can start off with the Ozempic case. And it might be interesting to know that 4 years ago, the total Ozempic market was $14.2 billion in the United States. And in the last 4 years, it is now a $77.1 billion business.
That's about a 500% increase, something like that?
Yeah.
My gosh.
Rapid.
That's just one drug. And of course, there are other drugs that do that. But the side effects of these things are becoming more interesting as we go. And things are coming out, and perhaps the age-old rule that we had for 3-year clearance for a drug from the FDA, which was reversed approximately 15 to 20 years ago, and they dropped it to 2 years. I don't know if that was the best move, just being conservative as I tend to be. So the Ozempic thing is and there are several types of that. The generic names are complicated. I had to write them all down here. And we have Ozempic and Rybelsus and Wegovy, which are all semaglutides.
Gotcha.
And then you have liraglutides, which are Victoza and Saxenda. And then there's the dulaglutides, which are Trulicity, and the terzepatides, which are Mounjaro. And you'll have a spelling quiz at the end of this. Figure all that out.
Good luck with that. Good luck.
Yeah. So the number one side effect from ocular thing is a disease called non-arteritic ischemic optic neuropathy. And unfortunately, that's a blinding condition. And now the incidence is only 1 in every 100,000. So it's very small, but still it's there. And they don't know if it occurs with the other variations on this theme in terms of all those other glutides we talked about. But certainly the main thing to come from some of these studies was that if the diabetic numbers drop too quickly, then you have a high percentage chance that you will have damage in the eye. The eye is the first place that diabetes goes to anyway. And so if you drop the level that it becomes accustomed to, you lose vision. And that's scary because some people are very excited about these drugs, take a bunch of them, drop the diabetes very quickly and wind up losing vision. And by the way, that's permanent. It doesn't come back.
Well, before you weigh in, I was just going to say, I think that goes back to what we were taught even back in school when we talked about blood sugar or high blood pressure, high blood sugar, that if it's high, you want to bring it down. But the worst case is to bring it down really fast. And then you have like a diabetic coma. So you have to be very cautious, especially reversing from one high to low and how you go about it.
Yeah. And this is interesting, because like Dr. Terrezza said, these drugs are not new. They're just new to us seeing the amount of volume. So even to, say, a less well-read practitioner than Dr. Terrezza, it would be very hard to ignore some of what we're seeing because there's way more data points nowadays. And speaking on your non-arteritic ischemic optic neuropathies, like Dr. Terrezza said, this is not an ultra-common condition, but it's devastating. It's a unilateral, one-eyed, painless, sudden loss of vision where it just goes kaput. and then you worry about risk for the other eye. So in some cases, someone can go from a normal sighted life to blind.
Because according to this thing, in 2024, 6% of U.S. adults are actively taking
That's a lot
this.
of people.
Yeah, that's millions and millions of people. So even though it's a small percentage, don't get fooled, because times that number, you get a big number.
Well, go back to Wegovy and Ozempic. I mean, certainly with diabetes, blood sugar, but now I'm seeing commercials for just weight loss, where
Right.
patients are maybe don't have blood sugar issues, but are just using it to
Yeah.
lower BMI or whatever reason they
Or
need
they'll
to
get
lower
it.
weight.
And now all these, pop-up online compounding pharmacies, they will have someone, do a virtual consult and prescribe it for you, and they haven't even weighed you, I mean, I just think, of course, improving blood sugar is always, not always, but for most diabetic people, having a lower A1C is usually a good thing. Being lower weight is usually a good thing. Having stability in the blood sugar is a good thing. But be very careful, make sure you're listening to your doctor, you're actually seeing a doctor, and you're monitoring these things, because nothing's a miracle drug, there's always a drawback. And I think some of the drawbacks may be starting to expose themselves now that we have more data.
Well, just taking a step back, we're certainly not saying you shouldn't be using these medications. We're just saying that, certainly you should be aware of how it impacts the eyes. We want you to have a full picture before, talk to your primary care physician, talk to your specialist, talk to whoever is treating you or prescribing these medications, and just be aware of what some of the some of the contraindications, some of the side effects are. And the biggest thing we're bringing this up is if you have vision loss, you have something that's going on, come in and see us. It may, a lot of patients sit there and say, oh, maybe I just didn't see today, or maybe it's something minor and it'll come back tomorrow. But if it's a non-arteritic ischemic event, if it's a vein occlusion, artery occlusion, it can be serious stuff where it could be a permanent vision loss. And so we want you to be aware when you're on these medications, certainly, especially with the eyes, come in to see us. We have you. We can, if it's something like that, we'll work you in the same day. We have office visits, even though we're booked out for full exams. We save slots for same-day office visits, or, if it's not urgent, getting you in at least sometime in the next few days. We want to see you because we want to do all we can for your eyes to be as healthy, and certainly for you not to lose vision or any of this stuff to become permanent.
The rate of diabetes is increasing almost exponentially now in the United States. So the number of people that really need close monitoring is skyrocketing. And with that in mind, that's why our practice has grown enough to get the kind of equipment in to monitor and catch these diseases. As Dr. Bell said, the earlier you catch something, the better it is, regardless of the name of the disease. But if you have you have to be big enough to afford the kind of diagnostic equipment to pick these things up earlier. So it's not really a function of the brains of the doctor, although that helps, but having the equipment in-house that will detect these kind of things is critical.
Well, I guess I would back up as far as, with lupus, I see a lot of patients with lupus, rheumatoid arthritis, other conditions that put them on hydroxychloroquine or Plaquenil. And we have studies, we read all the literature, and usually with these patients, we try to catch them as soon as we can when they start on the medication, maybe give them a baseline OCT visual field, do photos, kind of look at everything. That way, over time, we can watch and make sure there's no changes that are happening, and if they are, we want to catch it as early as we can before it becomes a problem. And I say that to say that might be the way we need to start treating diabetic patients. We might need to start doing baseline photos, doing baseline OCTs, and doing that way we can pick us, because, we look at things and our eyes are great, but sometimes our eyes can't pick up the smallest little changes for as edema or something, but an OCT or a visual field can.
Well,
that might be where we're heading.
That's right, and it's already happened for one disease. So macular degeneration, age-related macular degeneration, is the #1 cause of blindness in the United States for people over 55. And there's a test, and I've had it for a few years, it's in 2 of the offices, is a virtual reality test that can pick up the presence of that, particularly in people with a genetic predisposition or people that smoke, that you can pick it up 2 years before you can see it. And I see diagnostic testing going that way to a different level where it's not just a visual exam and you go. That's very limited. And I think that medicine is going to go this sophisticated way via AI, actually, and so where it can pick up things that the human eye can't.
And what's speaking back to, actually both of these conditions, but especially talking about Plaquenil use, a lot of times these are sort of chronic inflammatory problems. So patients will be on this medicine, tolerating it well, and it's working for, half of their life or more. And the issue with that is a lot of times the risk level is based on cumulative dose over a lifetime. So the longer you've been on it, the higher the chance of a irreversible damage to your central vision. And, of course, I don't want people to run out and stop taking what they've been prescribed from their, rheumatologist. But, if we do catch anything early like that, we will reach out to your, physician, and we will see about teaming up and figuring out what is the right move. Is it safe to continue? Is it not? And so it would be, definitely better to know on the front end for anything irreversible, right? You would want to speak with your prescriber and consider other options potentially instead of lose vision.
Well, I will say I think that's the great thing, especially in the last 3 or 4 years, that I've noticed that we didn't have 15 or 20 years ago. And that's patients coming in to see us that maybe were referred from their PCP or their specialists that are starting to realize that certainly looking at the eyes is a great way to monitor and assess patients with diabetes and other conditions. And so they're referring patients to us. Certainly we're dictating letters, we're coordinating back and forth. That way it's kind of a team effort where we can work together to best treat these patients.
Yeah, and it's kind of when we do an eye exam, even without a lot of the advanced equipment, it's one of the few places you can see small blood vessels in action, without imaging, without, injecting dyes and doing scans. Even a regular dilated eye exam, we look at the inside of the eye and we see the blood moving through the blood vessels. And that can tell you a lot about how other blood vessels may be performing. So it seems so routine, but it's actually fairly impressive when you really think about it.
Well, I think we have the time to do that, and even either a busy general practitioner or even specialists who are involved in critical cases of care do not have the time to check out these early cases and spend time on that. That's why it's a profession in and of itself to do that. And that goes for dentistry as opposed to endodontists or others. There's a lot of similarities here in neurologics and neurological surgeons. I mean, they're two separate entities. And I think that somebody to coordinate, look at all this data, put it together, get back with the family doc, that's a lot of work.
Kind of the quarterback, just kind of, looking at the moving parts and just saying, look, maybe I'm not going to catch the 40-yard pass, but at least I know that a pass is happening, and I can tell you when it's coming.
Well, as we go along, as literature, as studies come out, I mean, just speaking with Plaquenil, for example, when I first graduated school, certainly I saw a lot more cases with Plaquenil toxicity than we see nowadays. And part of that, and I think the main reason for that is we've learned along the way that maybe males and females maybe have a different dosage. Maybe we adjusted on body weight.
Yep.
There's a lot of things that we've learned through the years of how to lower the chances or the percentage of these patients getting to toxicity levels. And to your point, some of these new medications that have come out, hopefully we got it right now, but as we go along, a year, 2 years, 5 years, we may learn more and maybe better as far as adjusting things where hopefully it doesn't lead to negative outcomes.
Right, because no matter how good your study is, whether it's FDA or the company doing it or whatever, it's hard to beat data from it being released into the population because, as Dr. Terrezza was saying, the scale, it goes very much so magnified. The different physicians looking at these things goes exponentially, larger. So retrospective looks at how things happen are always interesting compared to how they thought it would look, proactively.
I think the importance of the local doctor that you can trust becomes critical here, particularly, and I'm going to hit a subject which may cause trepidation, but the Department of Health is under scrutiny now, and is having problems with its credibility as a function of facts versus non-facts. So that might be another reason to stay local and check with your local, be he MD, family doctor, orthopedic, or optometrist.
Well, the other big one I think that we hadn't really brought up here that I'm starting to see a lot more commercials on is just thyroid eye disease, whether it be Terrezza, whether it be other medications. Certainly, these are things we want to watch. You know, do you have proptosis? Are you seeing double? Or do you have pain on eye movement? There's a lot of things that we're certainly looking with that as well.
Are they dry?
Yep.
You know, there's a whole kind of gambit of problems, some not so severe, some severe, and almost all of them have a remedy now. So I don't know.
True. And thyroid eye disease is one of the most misdiagnosed conditions out there because it mimics other symptoms that can come from many other sources.
And just kind of looking at our, last category here, other things that can tend to cause vision shifts from systemic treatment, radiation, chemotherapy, sometimes that can speed up cataract production. Also, once again, the back of the eye or the retina, choroid, is a good spot where you can see vascular tissue to make sure there's no melanomas or anything fishy. Also, long-term steroid use can speed up cataracts if you're, kind of one of those chronic
Good point.
inflammatory conditions. So, moral of the story, the eyes are attached to the body, so sometimes they overlap more than we may think.
All this feeds into, I guess, I would say kind of what our motto is. When patients come in, they say, hey, I want to see better, or I want to do this and that. And we're always going to check for glasses. We're always going to check if they want contact lenses. We're going to do the refractive part of the exam. But I think what kind of sets us apart is we're going to check all the health stuff too. Patients all the time, why do I need to be dilated? Why are you asking so many questions on my systemic conditions, what medications I'm on? And these are reasons we do all that, because we're going to look in the eyes. We want to make sure that none of your medications are affecting or having a negative effect on the eyes. We want to make sure, hey, is there blood? Is there bleeding in the back of the eyes? Hey, we can't see the lens and look for cataracts unless we dilate sometimes. There's so many things we're looking at in the back of the eyes. That's the reason we want to do that. That's the reason we want to dilate. That's the reason we do the photos. That's the reason we do all that we do, because when a patient comes in and they said, hey, I'm blurry, what is it? Is it because the glasses? Is it because cataracts? Is it because corneal edema? Is it because macular edema? We could not answer that question appropriately unless we do all the things that will give us exactly what the cause or the culprit is.
And I wouldn't feel good, I don't think any of our doctors would, if we didn't at least have an explanation for, or a rationale for why are you not seeing well. We wouldn't sleep well at night. I don't think you would.
No, and the detail required to answer those questions, sometimes it's overwhelming, but you have to do it.
Yep, it's not easy. Sometimes there's a clear-cut answer as far as what's going on. Sometimes we got to dig deeper. Sometimes things like, if I'm having headaches or I'm having this allergy, hey, let's trial and error trying to figure out what the culprit is. But we're going to do all that we can to find that answer. And if we can't, we're going to refer you to a specialist or someone who hopefully can.
We don't know everything, but we know in town who should know or what direction to point you in,
But yeah, if you're on any medications that you have any questions, let us know, ask us, come in. I have patients all the time that say, hey, I'm going through chemotherapy, I'm doing this, I had a stroke, I did that, So all that feeds in, and we want to help you the best that we can. TerrezzaOptical.com. We've got multiple locations in and around Pensacola. We've got 2 in Alabama. We've got one that just opened up with Dr. Bellard at Baptist, right there at the Henderson Building, Baptist Hospital. Our newest location in Navarre just opened, right there at Harvest Village.
Harvest Village, that's correct.
In Navarre. So come see us, give us a call. We'd love to see you. Thank you for watching the podcast. Stay tuned for future episodes. Thank you.